Okay, we'll come out of executive and shareholders into regular. You can live stream this, Jen. Okay. Okay, so next up we have planning.
Good afternoon, Madam Chair and members of the council. Yes, this afternoon we have planning session specifically related to the federal funds that CSKT received from the American Rescue Plan Fiscal Recovery Fund, a Treasury Department program that was established. Very similar, although with some distinctions, to the coronavirus relief fund that CSKT received under the CARES Act. And this planning session is intended to walk through a similar process that we went through for those funds. I'd like to start by walking through some of the guidance that we have currently, and the amount of money we've received, and then some examples on how the Treasury has indicated we could spend that funding. So,
Rick, before you move on, I just wanted you to let the people know when we received this first amount of funding that was based on our enrollment data, because there are rumors out there that we have had this money for a while.
Yes, sorry. Thank you, Madam Chair. Yes, so the amount of our first tranche from this fund, this is the 20 billion that was set aside for tribal governments of the 350 billion made available to states, local governments, cities, and tribal governments. Our initial allocation was based on two factors. There was $1 billion that was split evenly amongst all the tribes. That was roughly 1.7 million. And then the first allocation above and beyond that was enrollment based. So our enrollment in the submission that we made was just over 8,000 members, and it's basically the same number we have currently enrolled is what we used, and that factored in and spread across all of the tribes in the U.S. gave us 38,917,000 and some change. We received that last, I guess, officially at the very end of the day on Thursday of last week, but it was late enough that our bank and our staff didn't actually receive the notice that the money had hit our bank account until last Friday. So we're awaiting another allocation, and this additional allocation will be based on employment data that we will need to verify in early June. I believe it is the second week in June that we will be asked to submit our employment data or confirm our previously submitted employment data. And then within, I would imagine a week or so from doing that, we would be able to know or potentially have received the second tranche. At this point, I don't even want to speculate how much that would be, but I imagine it'll be some number above 1 million. I just don't know how much the factor would be. But as we do receive that additional funding, what I was hoping to do today is really kind of a priority setting exercise, so that we can just kind of decide what we want to do and build out a plan over a 3-year period. Because a big distinction with this funding, as opposed to the CARES Act coronavirus relief funds, is the time period in which we can spend it. And that is a 3-year period, or approximately a 3-year period. December 31st, 2024 is the spend by date for these funds. So we have a lot longer time frame, which means we can plan in a little different way. We don't have to necessarily get the specific projects kicked off today, like we had to with our prior funding. But I think it's beneficial in that extra time means we can focus on the priorities, and then have staff develop plans to bring to council, and kind of do it in a more structured manner. This time, not have to hit the ground running. To do that well, having a ranking of what council's desires are would be helpful.
So before you move forward, I just want to say, when I did the message from the chair in last week, Sharkusta, I put December 2023, and it was actually 2024. We have 3 years to spend this money. So for anybody listening out there, I just wanted to make that correction.
Thank you, Madam Chair, and I am going to confirm. Yes, it is December 31st, 2024. I didn't want to add to the confusion, so thank you for clarifying that. So I can, I guess, make sure council's okay with that kind of approach, and then I'm prepared to walk us through the different use areas, the eligible use areas that Treasury has put out guidance on, and some of their example projects or example uses. And then all throughout that process, I think if there are specific things that the council would like to consider from a CSKT standpoint, let me know. And in this spreadsheet, I'll fill in the blanks here. I have 3 already that came from Carol via email. And those are Recovery Hall, Family Drug Court, and Community Gymnasium. And I think they all fit within the structure. So whether they rise up to the level of priority or not, I guess will be up to the entire council, but wanted to not forget to put those in.
Anita?
I'm sorry, Madam Chair, I just had a question, Rick. We were to send them to Ryan, right? So I know that I actually put 4 down.
Yeah, thank you, Madam Vice Chair. So I guess if you have those, and I haven't seen them because they went to Ryan, please share. What Ryan had asked for on Monday was kind of overall priorities. And Carol had initially responded with her priorities for the American Rescue Plan. If anybody else did something similar to that, there's probably a lot of crossover in the council priorities in both instances. So if I don't have those, please let me, or please stop me and we'll just add them to the list as we go along. Okay, so first, first category of the approximately 6 or 7 categories that the Treasury has grouped their eligible uses into is supporting the public health response. And this is the COVID-19 response bucket as much as anything. So it's in their examples, services to contain or mitigate the spread of COVID-19, behavioral health services, payroll and benefits for healthcare. And when I said et cetera here, what I was getting at is that this is basically the same concept as we had under the CARES Act funding, which is if somebody is required or is primarily engaged in responding to the COVID-19 public health emergency, their payroll and benefits are eligible uses here. So this would be healthcare workers and other things like public safety and et cetera. There's fairly broad room within this group to include things like recovery hells. Behavioral health services is kind of a broad category. So I think family drug court, substance abuse, mental health, those all kind of fit within the scope of this eligible use area. The next one is replacing public sector revenue losses. And
so is this the part where you wanted us to chime in if we had something in this particular category?
yeah, and I'm willing to be very flexible here. So if you have something to share now, we can do that.
Okay, does anybody have anything to add to this category? In the priorities that I sent to Ryan, I did have, mine was more categorized as wellness courts, not, Carol's a specific family drug court. Mine was more wellness courts because I've seen family courts, drug courts, veteran courts. So I just want to kind of add that concept to the, this area, but it also ties into a larger discussion that council's been having about substance abuse treatment. So I think a treatment center is one aspect of it. I think our courts is another aspect of it. I think our defenders, reentry and Morningstar supportive housing are also fit into that, as well as other housing possibilities. We know that SCAHA is for a certain category of people. It doesn't meet all of our housing needs, but I think it all ties into the overall needs that we have to address here as far as our overall substance abuse and mental health strategy. So I'm just thinking big picture.
Madam Chair.
Sure, Mel?
Thank you, Madam Chair, for adding that, because as you guys know, we've been trying to talk about multiple priority setting exercises, and it's kind of getting a little bit cluttered in my mind as far as which priority set are we talking about for which funding category or whatever, and I don't know how you guys want to maybe sort that out ultimately, but you had the session that I wasn't able to attend with the group in Helena that established some priorities, and then prior to that we had talked about how do we take an action to establish something in response to the alcohol and drug treatment needs that the work we're doing with behavioral health and tribal health. And then I see the information that Ruth just added to the chat about other funding sources available for similar priorities that could be used in lieu of. So we have several funding categories, I think, that we have to plan for. And ultimately, we probably should try to focus on, established set of priorities in some order. So thank you for bringing that up, because I know the resolution that was drafted for everybody's consideration seems to have been tabled in order to add other priorities. And I think that in this category that started to be built with Carol's inputs here, I'd like to see that defined as inpatient treatment for either full substance abuse or detox. Thank you.
Okay, any others? Bing?
Thank you, Madam Chair. Just to follow up on what Charmel was saying there, I know for a fact that some of the health and dental workers didn't receive any incentive awards up there, and I know a lot of them guys. I know a lot of them people up there, but they worked hard, and and a lot of them worked right through the pandemic and whatnot. And is there hope we could add this to that? This category too. So say some of them that didn't get paid, or receive that incentive can go ahead and get that this time around.
Madam Chair, I can address. There's been a couple things that folks have said. One, I can't remember who mentioned it, but housing infrastructure and homelessness, kind of continuing the work that we had started with the CARES Act. That is a specific kind of investment, but in this grouping, they're calling it equity-focused services, but it's tied to disparity in populations, and so we can cover a wide range of topics here. And the question Councilman Matt was just asking, there's an entire category covering premium pay for defined essential workers. And when I get to that section, I can pull up or read from the guidance on kind of what that was intended to look like from the Treasury's perspective. But there's more flexibility there for us to define essential. So I think if that becomes a priority for council, we can definitely look into how we go about accomplishing that. Any other kind of high level things within the public health response realm?
I don't see any. Looks like we can move on.
Okay, thank you. The next one is replacing public sector revenue loss. And this one is, there's a relatively involved formula to calculate what that number is. So I think if this becomes a priority for council, we can just say, yes, we can run the calculation and decide probably at that point whether it's too much allocated to recovering governmental revenues, or whether we just want to transfer that funding and move on to other projects.
Carol? Madam Chair, Rick, so if I understand the replacing public sector revenue, does that mean like just a business that failed to get in on the Economic Development Office, what they presented for revenue recovery for small business? Is this the same?
No, this is specific to, in our case, this would be the tribal government. So looking at our revenues, and there's a formula for going back 3 years pre-pandemic and calculating an average and then comparing it. And then once we do that, though, it basically, it gives us an amount that we can effectively transfer into our general fund to basically fill up the shortfall we had. There are other sections for small businesses and individual household assistance that are actually a significant focus area within this funding. Okay. Feel free to stop me if there are other questions. The next large category is water and sewer infrastructure. And this is basically from source to home. So it can be for building or upgrading facilities, transmission lines, distribution channels, and storage in the water and sewer infrastructure arena. There's some guidance that they put out that it should align with EPA project categories, but I should probably actually just delete that, because as a tribal government, we have a lot more discretion here in how we're defining kind of the needs of our community. But within this category, we could definitely look at tackling clean water, sewer issues. And I think that would include SCAHA, it would include, individual tribal members or the community as a whole. We do have quite a bit of discretion here.
Martin?
Thank you, Madam Chair. Thanks, Rick. So the last time we had talked about putting new wells into the home sites in the communities, and that didn't happen. Did housing receive funding for that? I know they're working on their infrastructure as well, or is that something that we would need to fund?
So it's a good question, and it kind of ties back to Charmel's point about this is one small pot of funding in the midst of a much bigger array of funding sources that are coming to the tribes and to our related entities. There is potentially money going to housing. I don't know specifics, at least not well enough that I want to share an open session, because I'm likely to get it a little bit wrong. But I think this would be money that would supplement other funding. That I can put it in the context of, this is the most flexible funding source that we're going to have as it relates to coronavirus funds coming from the feds to do water sewer things. So if we think of that in general as a priority, we can go to housing or to tribal health and look at whether they have gaps and what portion of this funding they could potentially utilize.
So just for clarification, Rick, in the past, in the past year and a half, we've had several, I guess, failed sewer systems, and maybe it's where someone from the house to the city system, that part that's their responsibility has failed. Is this something we could have tribal members like apply for through a grant, and we could help them fix that? Because a lot of people either are not, these aren't housing houses, SCAHA houses, or if they are, their ownership. And so people just don't have the money. They don't plan for those kind of maintenance type things. So is that something we could use these funds for?
It is. Probably that would fit within the equity-focused services section more than the water and sewer infrastructure, but I think generally speaking, yes, this could be done. Like if that's a priority, and actually let me write it down. If this is a priority, then we could do it a few different ways. We could work to develop community infrastructure, or we could work to provide assistance to individual households to cover those things. Basically, like a dire need type of project, individual project-based assistance to families.
So I had another example. I had a phone call last night of an elder household where they hadn't had their ductwork cleaned forever. And so they were actually both on oxygen. And so I thought, that might be something that we could fit into this, as well as a roofing issue. So again, these are things that Anita had talked about, for the last few weeks when she was looking into the rural development assistance program. But, our people just aren't qualifying for that rural development program. But Bing?
Thank you, Madam Chair. On that note too, I just had a phone call too last night on the same issue. And they're supposed to be trying to get some fire insurance on their house, but they can't get fire insurance on their house because of the roof being too bad. And in order to, and say you don't have the money to get the roof fixed, so they can't get fire insurance, and the bank is on them for the money, or they'll have to do something about the house because they can't get the fire insurance on.
Anyone else? Anita?
So thank you, Madam Chair. And Rick, I see you're already typing in there. That was one of my priorities in that investments in housing. I think there's a number of people who are over income for programs. And I mean, I see us helping other individuals that are less fortunate, but I think there's a number of people out there that could benefit, like Shelley mentioned the roof, and there might be floor issues. I mean, there's a number of things, and they don't have any programs to help them. And I'd like to for sure see an individual grant program for not only elders, but for other individuals to fix their houses and any other issues that could come along with that. There was one other thing I forgot there. I'll have to come back to it.
Any others in this section? Or I guess there's a lot in this section. We just jumped from water and sewer infrastructure to housing.
Yeah, we did, Madam Chair, and so I think under water and sewer, those are kind of the big projects, and I'm going to add one here, and I'm going to call it the SCAHA wish list, just as a placeholder. But I think those are the types of projects that we're thinking about, community wells and sewer systems and stuff with an infrastructure piece. On equity focused services, so the kind of overall guidance here is that the hardest hit communities and families need some additional flexibility, and they need it to address health disparities. Those we might have already covered under the mental health or the substance abuse, or some of those other healthcare related things that we wrote earlier. But it could be even broader than that if we define it that way. They have housing needs, so homelessness issues, I think, would fit in here. And then there's also the educational disparity and healthy childhood environments that are focused here. So these are things that are, their examples are tutors for kids that might have fallen behind because of the school closures, or not great access to remote learning options, those types of things, as well as with kind of recovering from the shuttering of programs. So Boys and Girls Club couldn't open, so kids didn't have anywhere to go. Can we help socialize and ensure those opportunities are available? That's kind of the overall focus of this equity section. So I've written a few things here. If there's any others that council wants to add, I'm happy to plug them in.
So I guess in addressing educational disparity, I don't know exactly if this would fit in there, but I'm thinking of it from, I guess, more of a cultural perspective, I guess. So, one of my top priorities was youth engagement. And I'm not talking about the one-shot activities that we do, like 3-on-3 tournaments or camps or whatever. I'm talking about like a whole preventative strategy, that's going to promote healing and prevent kids from, going to the dark side. So more of a cultural connection to the land. And, part of the strategy might be these, camps or whatever, but I think that's, in my mind, that's how we should look at education. It's not just public school education. It's, more cultural education. It also has to do with the health disparities, of, eating healthy, physical activity. That's what's causing our health disparities is, all of our bad food we eat, or sitting on the couch, or, being on our phones, not being connected to the land and connected to the culture. So I guess that's, for me, addressing educational disparity is how we define education.
Yeah, so specifically in the fact sheet, they define this as addressing educational disparities through new or expanded early learning services, providing additional resources to high poverty school districts, and offering educational services like tutoring or after school programs, as well as services to address social, emotional, and mental health needs. So there's quite a range of, I guess, just in that last section, social, emotional, and mental health needs, we'd have to look specifically at the guidance and see if there's any within the 160-page document that the Treasury put out that Katie summarized for us. But within that 160 pages, there might be a little bit more guidance. But I think if for us, a cultural education program is a priority, we should at least start there.
Fred?
Well, I think there's a segment of our population, and Anita and I was kind of talking about it here. That may be just over that threshold of making too much money to qualify for certain things. But yet they go to work every day. They might be minimum wage. There might even be a couple with minimum wage and homeowner, and it seems like that there is a segment that is kind of left out on the limb or the street, so to speak, because of just being over that. I think it'd be nice to be able to address and maybe give them some assistance as well. If they're an elder and they're on Social Security, and those guys certainly understand that, but I think there is a segment that is trying to come to work every day, but yet they just are barely making ends meet, raising their kids and expenses that go along with that. So I don't know if that's something that we can consider or not.
So Rick, would that come under prioritizing low to moderate income workers?
It could there, or it could be within the addressing the negative impacts by providing assistance to workers and families. Or if we wanted to go kind of more broadly or more specifically childcare, we could probably provide support related to childcare costs as a almost like we want to help people get back on their feet by removing this burden of or some of the burden of covering these costs. So I think if I put it in assistance to workers and families, that we will at least make sure it's covered.
I got some.
Anita?
Madam Chair, when we're looking at, we want to look out for our elders and our children. I wonder if there's some place or a placeholder that we can put people who their kids are they're being raised in town, and if there's entrepreneurs or someone out there, and I know that we had one that had an equine therapy, taking kids out in the country, if it isn't gardening, some kind of farm setting, animals or something like that, that if these businesses are out there, if that is an educational component that we can start providing to our youth, that and we've got tribe owns land, we own ranches. I mean, there's things out there. I think if an individual had that start, and I don't know if that's something economic development could help us with, but it would be nice to have a place that these kids could go to. That's the only way they're ever going to learn, you know, about where the food comes from and where the animals are and stuff. And so I don't know where that would exactly fit in. I'm thinking education, but
Yeah, I think it could be included in the youth engagement. And, you know, we define that.
I just added a section under promote healthy childhood environments. I don't know if that's exactly the place for it to fit or not, but I have it there. And if I captured what you were saying, Anita, that it would be providing opportunities for youth to engage in an educational way, but specifically in ag or food or just connection to the land sort of way. I'll assume that's not a no, at least. Any others, Madam Chair, that I can't see? Any other comments or questions within the equity focused services section?
Well, I'm not sure if you captured this about health disparities, you know, focusing in on prevention. So healthy food and physical activity. You know, I mean, it doesn't have to be a specific project. Maybe it's a overall, I guess, initiative in a lot of different departments. You know, we know what's causing our health disparities is we're not eating right and we're not physically active. So however we can incorporate that into whatever we do, I think would be addressing that. And if there's specifics, go ahead, Martin.
Yeah, I think that I'm not real sure how this is going to fit in there, but to that point, the studies out there are crazy about how unhealthy people got through the pandemic, especially our youth. I've seen 25 pounds, I've seen different numbers of weight gain, and that's going to have lasting long-term effects on our people. And so if we don't get a handle on that now, in 20, 30 years, we are going to have a big, or sooner, have a big, diabetes and all these other issues that we're working on now. So, I guess I'm waiting for the big infrastructure things for some of my ideas, but, access to public lands, knowledge of public lands, maps of where people can go out and hike, obviously fixing things like our walking paths for our elders so they don't fall and break kneecaps, and safe places where there aren't dogs running around. So just a lot more availability of things to get people active.
Madam Chair, I don't know if we'll be able to fit all of those topics in here, but I'm going to leave this just kind of generally, so we can at least determine if there's a way to fit it. But the fact sheet for this section says addressing health disparities and the social determinants of health through funding for community health workers, public benefits navigators, remediation of lead, and community violence intervention programs. So it's more focused on kind of ensuring access and removing specific barriers than kind of the general let's get healthy. However, that doesn't mean that we don't have flexibility to sort of define what how we address the social determinants of health. So I'd like to leave it here, and if that's a priority, it doesn't mean we will be able to fund it, but maybe we can find a different avenue to address that, and just sort of keep it moving.
Sure.
Martin?
And Rick, I know that doesn't really fit in there, so I'm not, yeah, I just kind of went off on a little tangent about health. So like I said, I'm going to save some of those for down the road, because I have a feeling there'll be opportunities for that. So thank you.
Okay. Just for the interest of time and attention, I'm going to move on a little bit. The next section was addressing negative economic impacts, and that that included things like assistance to workers and families. So this would be the primary place where we could think about things like COVID relief, or something like a COVID relief payment to individuals or households. But we could also, instead of thinking about kind of a blanket payment like that, we could do something more specific, like was mentioned earlier with the individual home assistance, or like daycare or childcare grants, or things like that. The one thing we do have to do within this section is tie it to the, similar to the last COVID relief payments. It has to be tied to the negative effects of COVID, or that were caused by COVID. And the guidance that they give here, I'm actually just going to share my screen so you can see it. It's this section here. So may recipients use funds to respond to the public health and its negative economic impacts by making direct cash payments? And clearly the answer is yes here. But it does help us a little bit, definitely more than the last Treasury fund did, by essentially saying, if you don't use what the feds did as a guiding principle, then you really better have a strong support for doing that. When we look at what the feds did with their stimulus payments, and that I think was $600 the one round, and I think they did end up making it to 2,000 in the second round. And so we do have some parameters in that instance here, but we would not be able to, based on the amount of funding we've received initially and the number of tribal members, we wouldn't initially at least be able to send it all out as a relief payment.
So in this section, I just want to say that I do support a direct economic stimulus payment to individuals, but I also want to look more upstream about things like childcare. For example, there is not, to my knowledge, a childcare facility in our Lee. And 2 years ago, I had community members who were willing to, start that business, but they needed a facility. And I looked into the old community center at the powwow grounds, was told that that was a shop for maintenance. And there just really haven't been any buildings or facilities available. We have a lot of land, but we just don't have a building. And so I would like to look upstream at those kind of options as well.
Um, That sounds good. I'm thinking, I'm going to add that, Madam Chair, under the promote healthy childhood environments section. And I shorthanded it as building additional childcare centers or increasing capacity.
Yeah, I mean, like in our Lee, I think the one option that is there now is, if people are eligible for Head Start, there's also kind of that childcare component as well, but not everybody qualifies for that. So I think, if we just had a building, then, there's people out there willing to, try to start that business. So, and we do know from our report, the Economic Development Commission from the University of Montana Beaver, that childcare is a huge need in this economic recovery.
Madam Chair,
Carol?
I think it's more, to me, a few of them have shut down on the reservation, but there's a nice big facility in Ronan now that have been built for childcare, but it's the cost. Not everybody can afford and not everybody gets the childcare block grant. And when you're talking $40 a day for a child and you have 3 children, what's the point of working? I think so. Really, that's gets to be the big question for a lot of people. And I just know somebody just the other day that said, I can't work because I can't afford to take my children to childcare and don't make enough money. So anyway, that's part of the other part of the issue.
Any others? Anita?
Thank you, Carol. That is a concern. I don't know if this is going back, but we talk about the mental state that this whole pandemic has had us all into. I would sure love to see other event centers or something set up for adults. And, if it's something down the line or something, that there's something out there to do besides drink and drug and gamble and whatever. I mean, to me, that's part of a problem too. I mean, there's nothing for people to do. So if they do have some kind of event, it's a swarmed, because we've been locked in for a year and a half. And I'm hoping that somewhere down the line that we have a vision of maybe doing some kind of an amphitheater or something to where people can have events and start utilizing them, or some kind of buildings out there. That I don't know how everybody else feels about that, but there's very little to do as an adult, being we don't have any powwows going on or anything. It's difficult.
And Anita, I did add that as providing under the behavioral health services section, tied to mental health, and not to confuse the two necessarily, but just was an easy place to put it. But basically providing activities that encourage or support a healthy community engagement. It is my shorthand for it, and hopefully that captures to some degree what you were going for. Okay, any other things? So I did hear at least supportive of some degree of economic relief payments to individuals, but also want to do things like childcare and addressing the cost or the barriers there. Any other kind of specific things within the assistance to workers or families? And for consideration, what they talk about are things like the unemployment benefits, the additional weekly unemployment benefits, job training to workers who have lost their job, aid to households for food, like food issues, other financial insecurity, and things like survivors benefits and stuff that are more closely associated with COVID-19, burial benefits and things like that. Any of those ring true, or do you think we haven't covered?
One thing we talked about at our strategic planning in Helena was, we have a lot of jobs out there, but people just are not engaging in that, or, they don't want to work, or they're not qualified to work for those specific jobs. So I think some kind of workforce development initiative especially with our youth, because again, if they're not seeing the possibilities at grade 6, then it just doesn't happen, And so I think a real focus, and again, that's another youth engagement. I see it, Carol. That's another youth engagement thing that I was thinking about, educationally, as far as training opportunities for, career development and meaningful career ladders. So, Carol?
Yeah, I'm sorry, I didn't mean to interrupt you. That usually interrupts my thought. But I'm thinking that, as the last of the baby boomers myself, and I'm 62, thinking that we're starting to age out. And I've heard people say time and time again, I can't afford to retire. So I'm, even whether I'm 62, 67, can't afford to retire. So I'm going to continue to work. But those individuals I think, are moving to other jobs, maybe better jobs. And then the lower level people, individuals that are coming out of school or whatever, just aren't stepping up. And I don't think, there's a few on unemployment, but I don't think that's the issue. I think it's mainly the largest part of our population is the boomers are getting old. And there's just not people to come back in and fill in those back level jobs. And so I think that's part of the issue in my mind anyway. I could be totally wrong.
Madam Chair, I did put workforce development programs down. There are sections of the guidance that essentially say, no, you probably shouldn't do general workforce development programs with this funding. That being said, I put it down. I want to leave it because there are some aspects of displaced worker programs and sort of getting back in, or for workers that were in an industry that is now struggling. And so I think there's potentially something that could be done here. And then I don't know if I don't think the funding can be used to address anything specifically to Carol's point with kind of backfilling. but I will say I do see it as a tremendous need going forward. And I can come back at any time to this, but I want to keep moving. There's a few big things that I think will be relatively easy to get behind. Small business support. So this would be essentially a grant program, and in fact, they encourage basically a grant program, loans, some other types of counseling or what have you. So I think we could revisit or resurrect the program that we had at the end of last year, with maybe a 3-year time horizon instead of a 6-month time horizon, if that's something council is excited about.
Carol?
Quickly, I just want to say there are businesses that were missed, and it wasn't till after it was all over with and it was closed and I started getting calls, and I'm like, wow, I really missed the bucket on a lot of people who have businesses that were not even aware of it or noticed. And of course, the office can't get a hold of everybody either. So I think they tried to do what they could do, but I think if we do that, I want to focus on the people who didn't actually receive much, and not just small businesses. There are just businesses in general. And most of them are small though.
I'm going to leave small and put it in quotes. We're probably only talking about technically small businesses based on the definitions the feds will use, but I want to leave it there because it's in their guidance. So make sure that we don't get out of bounds.
Yeah, I would support that. I know we already have that submittables grant program, developed. So I think, like Carol said, there was a lot of people that didn't see the announcements for whatever reason. And then there were people that didn't think they qualified, they were egg businesses or, farm ranch. So I think that would be a good focus. Another, I think economics development's next phase that they wanted to do, but we ran out of time, was the artists and the, people that usually make their money at powwows, like artists and, different creative types. So I think that's probably another area.
Any other kind of specific focus areas here?
I think egg producers was one. I mean, that was one. That's where I got a lot of calls, with some of those people were missed.
Okay. And what I might suggest is that would be a good priority to give to economic development if council wants to support that, to identify the industries and businesses that might have been missed. Which kind of leads to the next one, which is speed the recovery of impacted industries. And specifically they are looking at, I put childcare businesses because that's kind of an industry if we're talking about not early childhood services, but private operations, that they probably were kind of hard hit because of all the increased costs for cleaning and protocols and just the number of people that weren't using them. We can change that if you'd like, but the others that they specifically list are tourism, travel, and hospitality, as well as all the supporting sectors that go into those industries. I don't know exactly what those would be for us, but I think given that we have 3 years, we could probably spend a little bit of time answering the question if there are kind of specific industries that we would like to support with this funding.
Ellie?
Great question. A part of helping them recover, especially for ones who had to let people go, would be trying to hire people back. And with it being difficult for anybody to get employees working again right now, would that be a piece of the workforce development program? Or would it fall in this category as a?
Yeah, I think it could. A lot of what the guidance is sharing here is it's more about just sort of focusing on whatever the issue is for those industries. Tourism, travel, hospitality. I anticipate that a lot of what people will be spending money on there are actually things like, hey, it's safe, come to Flooded Lake, or a version of that. I'm not saying we want to do that, but sort of finding ways to get the tourism traffic and the dollars that come with it into the communities. We definitely can talk about the workforce development piece as it relates to if those are challenges that those sectors have. I think we could get creative. I can't guarantee that without kind of diving into the weeds of it, but I think that's a good idea.
So I think we could also reach out to that tourism committee that we have internally to see if they have any input in that. And then I think we should, in workforce development, ask or add that whole displaced workers retraining aspect of it, because it seems like that keeps coming up.
The next one was rebuilding public sector capacity, and in this instance, it's really about employment levels for, in our case, it would be the government, but we could probably expand it a little bit to housing or other government-related groups. But what they're getting at here is if we had to lay off a bunch of people, we can use this money to bring them back. So I think this is probably one area where we don't need to spend a lot of time or focus, because we were able to keep everyone, for the most part, gainfully employed. And we can, if council would like, I can look into or have personnel look into anybody who might have been furloughed, for example, that was COVID related, but I don't remember any actual COVID related furloughs that that would really fall into this category. I think the only potential examples that I can think of are fire related, just the fact that we didn't do certain work, but that's my take. I'm happy to dive into it in a much more meaningful way if council would like.
Anita?
So Rick, what you're saying is that's this government, that's not the private sector, the
Correct.
Okay.
In the private sector, we're basically talking about grants or industry-specific assistance is the mechanism that would be most useful for us if we wanted to make an impact on individual businesses. Next one here is premium pay for essential workers. This is actually a very strongly encouraged section. And it really has two kind of themes. The first is they understand that the majority of workers were in the same boat that we were last year, where we couldn't really, based on the definitions of anything, put hazard pay into effect in any meaningful way. And there were still a lot of people who had to go do that work, and that it was disproportionately harmful, if you will, on low to moderate income workers. And so they being the feds, have provided guidance that says we can use this funding to provide premium pay directly or through grants to private employers. So we could, in this section, provide grants for premium pay to businesses. But just in the context of CSKT, it's premium pay to essential workers who must be physically present at their jobs, including nursing home, hospital, home care setting staff. Actually, I'm just going to share my screen. Make it a little bit easier. And so it's staff at nursing home, hospital, home care, farm, food production, grocery store and restaurant workers, janitors and sanitation workers, public health and safety staff, truck drivers, transit, childcare workers, educators, school staff, social services and human services staff. And then the limit that they put on it is we couldn't just implement this. We would have to look at, for each worker, the premium pay, whether or not it would increase that worker's pay above 150% of the state or county annual average wage. So this would require a fairly significant amount of analysis to determine if it's because basically they're focused on low to moderate income workers, and when we would have premium pay that puts somebody above 150, they say each of those situations requires specific justification. So they're not saying you can't do it, but it would be, I guess, beneficial for us to look at, to know beforehand how we are, or whether we need to address that 150%.
So I have a question. In these grants, would we be able to, let's just say, give a grant to a department whose workers make $11 an hour and bring that up to a living wage of $15 an hour for the next 3 years, and give that department or agency or organization, whatever, 3 years to figure out how they can sustain that? Is that too far outside the box?
Without going into the specifics in the 160-page document, it doesn't seem out of bounds. It seems pretty much in line with what they're asking. The one caveat I would have is if at some point between now and the end of 2024, it becomes clear that there really is no coronavirus risk, like let's say in this bizarro world, we kill it. It's dead and gone. And we don't have to worry about it again. Then I think we would want to walk that back at that point, sort of reduce the premium pay bonus there. But it also encourages, you can see at the bottom here, permitted and encouraged to use these to offer retrospective premium pay.
Ellie? I guess I'm confused on the premium pay. If we were able to raise wages and we had this money for 3 years, and then a department's not able to sustain that, we can't get people used to living at a certain rate of pay and then yank it out from them and say, now you're going to go back to $11 an hour. So that's concerning, unless it were some type of like a bonus payment, like a one and done type thing, or I'm confused about that, I guess.
Well, apart from the retro component, it would need to be part of their wage. It couldn't be a bonus. We couldn't say we're going to calculate 3 years worth of premium pay or anything like that and just give a bonus. It is clear that it needs to be basically like, here's your wage, here's the bonus, similar to hazard pay, where you're in this environment that is hazardous and you're getting an extra amount because of that. So there is a risk that people would become, I guess, dependent upon that extra pay, and we wouldn't be able to continue it. But that is kind of, I guess, the guidance. And if council wants to pursue this, we can definitely do a lot more of the legwork to figure out what. Because the one thing I would say is our payroll system would also be taxed here in order to track this well. And so I wouldn't want to put any kind of a clock on this that is short. I would want to make sure we're prepared to enter this situation. Is there, I guess, I will put it down, and we can come back to it if you'd like. The flexibility within the regs or within the program does allow the tribe to identify which of those segments it considers eligible for premium pay and add additional segments. So if we wanted to look just, for example, at healthcare, childcare, or janitors or sanitation workers, we could do that. I'm sensing, without being in the room, that we might need a little bit more deliberation on that aspect. So I'm happy to circle back on that piece. Okay, and then the final one, big area is broadband infrastructure. We have currently, because of our infrastructure request that went out, we have a plan that I think would really adequately address this if council wants to pursue it. And that is to invest in a significant amount of fiber throughout the reservation. It doesn't necessarily cover all areas, but fiber is specifically encouraged. Fiber infrastructure build out is specifically encouraged within this funding source. And the other thing that's specifically encouraged that if council wants to consider it is specific household or business access. So, you know, a lot of times houses might be within a mile from a fiber connection, but it just doesn't make it to their community because that last mile, that's kind of where the last mile concept comes from. It doesn't get into their neighborhood. We could assist in those instances, either by developing or covering costs on an individual household or a community basis. Basically, I think the gist is broadband's really important, especially as it played out to be true during COVID and the shutdowns, and do what you can to assist.
So a couple things related to that. Council had asked for an update on when our current towers were gonna go live. And then something related to that was the cost of fiber from Evro to Missoula to the Internet Hotel or whatever it's called. And then another one that comes to mind is the Bison Range. I think it was a $700,000 fiber access.
175, I think, was the Bison Range. So the short answer to the last two questions is we can assume 8 to 10 million. That is the estimate that we have put together to build a ring and basically connect all of the areas that CSKT has gaps. And that would be a CSKT owned network fiber ring that would feed our towers and connect us to the internet hotel. I think that cost is definitely allowable within this. The first question I didn't see Chuck on. I think he was on this morning, and he was prepared to give an update on that. Because we got bumped, I can have him come back in. And I know he was, I just got a note, he is here. So Chuck could potentially jump into the Zoom call and give an update if council wants to on where our current towers are. But based on the time of day, maybe it would make more sense to do it at Monday or a separate Tuesday or Thursday meeting.
Yeah, I think we have a lot of questions in regards to that. So if we could schedule a longer discussion for that,
Okay.
for that one particular subject.
Perfect. So I think the only question within the broadband infrastructure is, would we like to pursue that? And do we have a preference in terms of focusing on infrastructure, meaning fiber, or individual household and business needs? I might have heard infrastructure or read the lips.
And I'm not sure if you're seeing the comments in the chat about specifically Camas Prairie and Moe's.
Okay. I think both of those are covered in the fiber ring proposal that would connect us to Missoula. So I'll just we'll just assume that covers all of the gaps on the infrastructure side. And maybe after considering that, we can see if there's still any dead areas that we might not be able to address with infrastructure, and instead would need to look at individual household or business assistance.
Anita?
So Rick, and speaking of that, you said, Ruth was asking about how many homes, but I know that we had a problem down there, just as Mike was talking about Camas Prairie, the same with Moe's, and I know we've been having a problem getting towers or whatever, but we now own Bison Range, and we also got Berry Basin in behind us. So maybe that report that IT can give us a better idea of where we could support a tower that would give us service down in that area.
Yeah, I do. I think I would want to defer to bringing Chuck in on that conversation. Jamie, I think you sent me the notes from earlier conversation. If you could, I didn't realize that there were so many questions or comments in the notes section or chat.
Oh, in the chat, uh-huh.
If there's a way for you to grab those, because I don't want to miss any of the comments that didn't come up.
All right. Get back on my phone.
So I guess it's probably getting warm. It's definitely getting warm in my office. Everyone's probably kind of tired. The next steps, I think, here would be if council would like to, we can continue with the priority setting aspect, and that would look like, okay, of the things that we've written down, what's most important, what's second, and then from there we can send out, similar to the last time we did this, send out to staff, hey, council identified this as a priority. We're going to schedule sessions for each priority area to kind of lay out, here's possibly what we could do, and get council buy-in on kind of the overall direction.
Okay. Carol has something?
Yeah, Madam Chair, I want to set a date if we could, and what I understand, it is possible to do a payout to the membership, correct, Rick? That's what you said in here. So I would hope we'd set a time. I'm sure all of us are getting the questions from people. And I think just to set that time and decide what we're going to do would be nice to let people know, give them a little relief in their thought that there could possibly be something coming. So
Yeah.
I would like to do that sooner rather than later. And I think people, when I know that, or when Rob sent out the information, it was said to me that there won't be a payment because Rick said, and I'm like, no, that's not what was said. Because it's not Rick's decision, it's the council's decision, and he knows that. I'm not telling him anything, but I think we need to, yeah, I appreciate the information getting out there though, Rick. Thank you.
Yeah.
The other
And-
thing that was said, Carol, was that it was the women on council that were against it.
Well, I don't know if anybody's against it, but I do agree, Carol. It'd be nice to get some clarity soon. What I can do is send this list with a little cleanup that we generated today out to council with a request that everyone put a number in the priority level box. What do you want to do first? Like if you had to do one thing, what that would be your number one. And if all of council can respond, then I think either next Thursday or the following Tuesday or Thursday, we could reconvene and go through the responses and decide, okay, we want to set aside X amount of dollars right now for a payment or for small business grant or what have you.
So I guess in regards to that next process of prioritizing, I just want to remind council that this is only our first payment and there will be more money coming as far as the employment data. And then we also have potentially infrastructure dollars coming down, as well as the IHS that Ruth had identified. So don't let that limit you when you're, doing your prioritizing.
Okay, well, if council's okay with that path, that plan, and to reiterate, it would be us cleaning up this document, sending it out, asking council to fill in their priority list, and then setting a date on the calendar. I would prefer, given that next week is already semi-full, that we look at the following week. So 2 weeks from today at the latest that we gather, and by then we'll have some of the gaps filled in. We'll hopefully have everyone's responses and be able to start allocating dollars as well.
And if council hasn't replied to Ryan yet with their priorities, please do that. I think Fred has something before we end.
Well, I was just gonna just say, as always, my preference when it comes to a payout is, and I mentioned it earlier about, everybody gets it. And there's no income requirement. There's no, there's nothing attached to it. Everybody would get a piece of the pie. I don't know how much that would be, but that would be the rationale why I would think it'd be logical to do that.
One thing I would ask council to consider in that regard is, remember, this is 3-year money. So if we're talking about a payment, it's also, I think, important to think about what next year and the year after would look like, or would we want to do something similar in future years as well. That'll have an impact on the specific amounts.
Thanks, Rick, for all your hard work.
Thanks, everyone, and I'll shut up and let somebody make the motion to adjourn.
I will do that. Motion to adjourn.
Thank you for taking us through this process, Rick. Appreciate it. And there is a motion to adjourn. Fred? Okay, everyone have a good, safe weekend, and we'll see you back Tuesday.